I just ask you to pause for a little while and let us pray. Heavenly Father, we are truly grateful today for this opportunity of being able to share our medical skills today to the public. We recognize that you are the great God Almighty, the maker of heaven and earth, and you, Lord, rule and you reign in the kingdom of men. We recognize you're the source of all wisdom. You're the source of all understanding. And today, Lord, we want to give you thanks for your goodness in making life worth living. We're truly thankful, Lord, for our leaders who are in authority. We pray that you will continue to grant them wisdom from above, that, Lord, they will lead this nation. They will make the right decisions that will be of benefit to the people of this land. We pray that in so doing, we may be able to live a happy, a quiet, and a peaceful life. We pray for the many afflicted persons across this land, many who are plagued by sickness from the coronavirus and other medical ailments. We pray for your divine healing. And today, Lord, we want to recommend that you bring comfort and ask that you bring comfort also to those who are mourning, those who have lost their loved ones as a consequence of the coronavirus and also other medical conditions. Lord, we commit this meeting in your hand and we pray for your divine guidance and your blessing. In Jesus' name we pray. Amen.
Amen.
Amen. Amen.
Okay, so good morning, everyone. Welcome, Zara Burton, as well from the media, and everyone who have now joined. And we are going to quickly move on. We're running a few minutes behind. So I'm going to hand it over to Dr. Heyman, who is a senior family physician and occupational health specialist, who will be the chair of this meeting and will share with us going forward. I hand you over to Dr. Heyman.
Okay, good morning again, everyone. And we're so happy that you're here to hear our message today. The big news we're hearing over the past couple of days and indeed months in the past, and especially the past 2 days, we have been seeing an increase in the amount of the coronavirus cases. We have seen our positivity rate going upwards, approaching near 40%. And we have heard the cries from those who are managing the hospitals that the hospitals are overwhelmed by patients. And so we have also heard from Parliament, we have heard from our politicians, both the governing party and also the opposition. We have heard also from the public health specialists. We have heard from the scientists. We have heard from the profilers. Now it's time to hear from what we call ourselves the ground professionals who have been actively treating, yet our stories seem to be left out. And today we want to complete the story of the coronavirus, and especially with regards to therapeutics or treatment. We are a group of experienced medical professionals representing every part of the island, and our common cry today and the common call today is that we are calling for urgent call for early home-based treatment and monitoring to minimize hospitalizations and death. Our treatment is no one magic medication. The world is looking for one magic medication. No, we don't have that to offer today. But with a clear understanding of the infection process, after 20 months of knowledge, we have various medications available to us to treat effectively. This panel believes in the use of the various vaccines that are available. We believe, as many professionals are saying, it does not prevent you from getting or contracting the virus, but if you do get the virus, you will get a less severe infection. We look also at the latest reports coming out of the USA, the UK, and Israel, and other countries, and we see that there is an increase in the rate of persons who are vaccinated are getting infected. We want to let this forum know that we stand ready to treat anyone who falls into this category. The Prime Minister has launched his program to go and into the nook and cranny of this island. We applaud him for this, to encourage the use of, encourage more persons to be vaccinated. But we want to remind him on this forum that he always tends to attract crowd, and the virus love crowd. So we know he will use his wisdom to prevent the spread of the virus. But should in case it gets out of hand or it broke out, as the Jamaicans would say, we stand ready to treat also. So today our key message is we recommend early treatment. The coronavirus infection is no hoax, it is real. We want early treatment. We want home-based monitoring, and this undoubtedly would lead to less hospitalization, less long COVID complications, and indeed less death. If our message is accepted and implemented, we believe that it will bring back hope to our Jamaican people. It will bring back a renewed energy in our society, and indeed the hospitals may come begging to us soon to send patients to them for treatment. We have a very great team of certified medical professionals. And at this time, I would like to introduce our first speaker from the Kingston area. She's a family practitioner, Dr. Suzanne Arscott. So I invite her now to come and do her presentation on her personal experience in treating the coronavirus patients. After that, our co-host, Dr. Roger Hunter, will introduce the other speakers. And at the end, we stand ready to answer whatever questions you may have. Please welcome Dr. Suzanne Arscott.
Good morning. Can you hear me?
Yes, Suzanne, good morning. We can hear you loud and
All right. All right. Good morning, everyone. And I want to thank the organizers for having asked me to present today. I do it with a heavy heart. I didn't expect, having had the vaccine rollout in March, that would be at this place come August, where our population is now under the gun again with this virus. But it is what it is. And we are in a better place than we were August of 2020. In August of 2020, we had no vaccine. All we had was our intellect and to understand the virus and how it operated in the human body and fight it from once we knew our physiology and our pharmacology, then we could do something. And we started the journey. I would say most of us would have had our first serious cases on or around May of 2020. And it peaked, that first peak, in September after the elections, and certainly after Christmas, we were all under the gun in March of 2021. The first thing I want to say is I want to thank my team. Without my team here at the office, I don't think I could have done what I have done. The first point of contact is your front desk, your receptionist, the person who answers the phone, my nurses, my triage nurses who are excellent and will come into the office and will say, Doc, we have a patient in car license number X, red Prado underneath the tree. I tell her, let them sit and wait in their car and I will come to them. We don't bring them into the office. We try and triage as best as we can. Once we pick up that there is a fever, And with the positivity rate now at 40%, you almost have to think that every second or third person that is entering your office could be a carrier of the coronavirus, and you must be extremely careful, not only for yourself and your staff, but for your other patients who happen to be there. Your little old lady who's a diabetic or hypertensive was coming to for her regular checkup. That being said, so each person out there in their public office has to have their PPE. You have to have your overcoat, you have to have your cap for your head, you have to have on your goggles, you have to have on your sun visor, you have to have on gloves, and you have to have a method that when you're coming out of the office to see them outside in the car.
All right, me get through. Me now current office.
Hello?
Conference.
I'm gonna, sorry, Suzanne, let me just mute someone. Go ahead, Suzanne.
All right, so the first point is your front desk. So your front desk identifies a client who needs your help. And once you decided to be a family practitioner, you have been in office, whether you've been in practice 10 years, 20 years, 30 years, you now have a moral obligation to look after your clients, whether it is corona or whether it's hypertension or diabetes or kidney disease. You now are their first person of help in their greatest moment of need. So once you get out there, there are 3 or 4 things you have to be able to check. 1, you need to check their temperature. 2, you need to check their oxygenation. Can I send this person home? Chances are by the time they have come to you, they've been already sick about 3 or 4 days. They have a heightened awareness that they did something foolish or they were in the contact of somebody who was sick. By the time they get to you, you're already into day 4 or day 5. Rarely you get the person at day 1 or day 2. I would tell you that at most times it's about 4 or 5. And you want to capture that population before day 6. What I tend to do is I let them turn away from them. I don't want them breathing on me, but I want to listen to that chest. I want to, when they tell you they're short of breath, you want to listen to all 5 lobes of that lung on both sides, front and back. You can put the stethoscope over their shoulder and listen on the front and make sure you don't hear any creaks or any wheezes and that they're not in trouble. Once that oxygenation is above 95%, and once you can start your treatment, you get them on something, antitussive medication. I start them on steroids right away. Day 5, day 6, start them on steroids. It cuts down on the inflammation. I don't want them to get that pneumonia, so I'm going to give them something that will cover. Whether you use a doxycycline, you use a Bactrim, or you use a macrolide, you have to use something to prevent that community-acquired pneumonia. The next most important thing you have to do then is your cell phone number. You are now bound to that person for the duration until that person is out of trouble. Once you can get that cell phone number, you can monitor them at home at 10 o'clock at night, 2 o'clock in the morning. They know once you write on the prescription that they have to get an oximeter. They have that oximeter, you tell them what it's for. You use your oximeter on them in the car, so they know that little device is going to help them. They're going to ask you, what else can I do, doc? Yes, you're going to do your vitamin C, and you're going to do your zinc, and you're going to do your vitamin D, and you're going to up their fluids. If they're asthmatic, you make sure that they have their inhalers, and you make yourself available. Once you can do that, you are now in close, as you are closer to that patient over the next 7 to 10 days than your own spouse. Because when you're up at 2 o'clock in the morning talking to them, it is critical. Then once you have done them, you have walked them through. If they call you at 12 o'clock and say, I can't breathe, they say, get out of the bed, go in the shower, steam, go and get that humidification going, and let us make sure that we can open up that airway. Not everybody has a spirometer, but everybody has a Pepsi bottle. So you can get a water bottle and you get a straw, and you teach them how to blow and do their own home physio. Blow those bubbles through the water. Get that, open up that lung, get that lung open. And for crying out loud, don't lie on your back. Lie on your side, prop up at 45 degrees, but don't lie on your back. So as a doctor, you have several modicums of help that you can get. I want to thank CDI, who is opposite my office, because when nobody else would do chest x-rays on my clients, they would do it for me, and that got me out of many a trouble. Thankfully, I have not lost any to date, and it's been a long 20 months, long. And I really want to thank again my team. I want to thank my support, which is this, the X-ray facility across the road. They do CT scans and chest X-rays. And I want to thank my family who have supported me this journey. Good luck.
Thanks, Suzanne. This is amazing. 100% amazing. God bless you. This is what Jamaica needs to hear, that we are in a different place. Mr. Chairman, Leroy, comments, please, briefly. I'm gonna unmute you. Unmute, Leroy.
Okay, so yes, basically, she mentioned the treatment usually in the first 6 days, usually the 4 day to 6 was highly recommended. You see, what we're encouraging is that this period that we consider as being early, we're talking about day 1 of symptom to day 6 of symptom. And so when the patient comes, as she mentioned, we'll do our protective gears, and also we treat them, and then we monitor them from home. She mentioned that she allowed them to have her phone number, which is excellent. So by that way, we can she can communicate with the patients. We can see if they're getting worse, and we can bring them back in if they are getting worse. One of her high points is that she sees them outside in their vehicles when they return, and that is also a plus. But the important thing is that they have continuous monitoring at home, and that's what we are recommended to minimize the hospitalization.
Excellent, Mr. Chairman. So can we move on to someone, Dr. Michael James? Shall we hear from Michael and his experiences in Oterius, treating patients in the community and in his office? Michael, are you ready to share with us your experiences? We heard from Suzanne, and we'll come back. Let me unmute you, Michael. Can you unmute yourself, Michael?
All right. Can you hear me now?
Yes, we can hear you. Yeah, just a
All
light.
right, great.
The glare to your left shoulder is a little right. You need to go right. Yes, Miss. Yes. All right. Yeah, that's getting better.
Dr. James.
Senior.
So I
physician.
thank you very much for having me on this forum and for asking me to talk about my experience here in Oterius. It has been a strange but good experience for me in terms of seeing patients who have this COVID virus. Let me get straight to the point, because I heard what Dr. Arscott spoke about, and I agree with her. But in her case, she had to go to see patients. I had to see them in my office, and it was I had to sterilize every time and make sure that everything was okay. But I've been using a particular drug in my office, in my setting, and I find it works quite well. I'm trying to get to the point, all right? And I don't want to beat around the bush. And I've been using Ivermectin in my office quite heavily, and against the wishes and the wills and the skin and the advocacies of the higher authorities. And it has been working. I've seen everybody from young to old, from 2 months old to 96, 86 years old. And people who have symptoms of COVID, when they do test, they are positive. That is after the fact though. And I've seen them and treated them. People with big comorbid, apart from age, they are hypertensive, they are diabetics, they have aneurysms of various sorts, and people who are debilitated from various other conditions. And I tell you, this is my personal experience. Once I put them on ivermectin, if I catch them in the first 5 days of illness, and I put them on ivermectin, along with vitamin D, along with vitamin C in heavy doses, along with some other preparations that will boost their immune system, they turn around in 3 days and they are back to normal, almost like 99%, 90 to 99% back to normal. And everyone has so far survived. Every patient of mine has survived. All right. And this is a numerous amount. I can't even check them. I was trying to pull the files, but there are so much I've stopped counting. And this is my experience. And this is where we need to understand what's happening to Jamaica now. Jamaica, we need to get to a point where Jamaica has been fully immunized or fully infected. I think if it's a pandemic, it means that everybody will have to eventually catch this disease. This is my own thought on the matter. And if everybody catches disease, they'll acquire some natural immunity. And enough to cause herd immunity so that they will protect the others who are not vaccinated or who have not caught the infections. But in the meantime, some of these people are going to get very sick. Some of them are going to die in hospitals or in wherever. But I think if you can catch, if the government can bring in some ivermectin into this country and have the people have it as prophylaxis. So as soon as a person has a flu-like symptom that we think might be COVID, they take this medication, they'll get better right away and they'll be having their own acquired natural immunity. So all the parties that are going on around Jamaica and causing mass spread of this disease is only enabling the young people and the young population to get this infection and spread it around. And they are being naturally immunized by natural immunity, by their natural self-acquired immunity, and causing them to be super spreaders of this disease. But I think that something needs to be done in terms of having to acquire this medication so that we can use it so that people will not need to go to the hospital to be hospitalized for severe COVID infections. Because as soon as the population understands that if you have a fever, if you feel sick, if you have flu-like symptoms, start taking this drug, bam, right away. In about a couple of days, they're a little bit better. It has been proven to be effective. And it is not just from me alone. This has been something that has been internationally tested and tried. Various centers, hospitals, groups, doctors have used it, and everyone has had positive results. So this is not just from this section of the world. But so far, so good, and that is my personal experience. Thank you.
Dr. James, thank you so much for that honest and frank testimonial. It certainly mirrors what we've been hearing from other independent public health providers. So I thank you. Thank you. All right. Mr. Chairman, I think perhaps you can hear from Dr. Jermaine Spencer in the West. Dr. Jermaine, are you here? Okay. Right. Lovely. All right. I'm going to mute you, Dr. James.
Sure.
All right, I'm Dr. Jermaine Spencer, CEO and founder of Bay West Wellness Clinics and Hospital, Montego Bay, St. James. It is very obvious that we all want to have or achieve the same goal, which is to continue life and to ensure that people recover if exposed to this coronavirus. The narrative should be the same all over, which is test early, treat early. That has to be the narrative. Initially, when the government, which they're trying their best with the information that they have and that their advisors are giving them, the initial narrative was to stay home, quarantine, wait 14 days, come back out, test and then come back out. It can't be that anymore. That narrative has to change. The narrative has to stay test early with symptoms and treat early. We have to do something because we need to prevent the progression of this horrible disease. In my experience, which I've treated hundreds of patients with coronavirus, not admitted, and those who have admitted, if I'm not sure if anybody is aware, but my hospital had devoted 2 separate areas for private COVID management. We have 5 high dependency units and 5 non-high high dependency unit for COVID only. We had to procure high flow oxygen, ventilators, specific for the management of COVID. What COVID patient need is just the ability and the time for their immune system to work and overcome this virus and to develop immunity to prevent further morbidity when they get it again. Because the question is not if, the question is when. And if we understand that this virus is now not necessarily a pandemic, but it's an endemic. In other words, it's not going to go anywhere. It's going to be with us. And if we extrapolate from the family of virus and you look in any medical textbook, any virology textbook, you realize that coronavirus mutates and changes and stays within the society. We can extrapolate from MERS, we can extrapolate from the other respiratory illness that we have had in the past of the similar family, and to realize that the longer we try to contain it, is the stronger it gets. So we need to develop immunity. We all know vaccine will help. The question is, what do we do now? And it is obvious that we are the public sector. It is obvious that the public sector is buckling, but it's buckling, I believe, because there's not enough resources available, bed space. The government has not necessarily approached us private physicians who have been managing majority of the COVID patients, whether they like it or not, because majority of the patients are asymptomatic and mild, and we have been managing it. In my population, in my group of patients, when I say treat early, I use the same ivermectin, and the same ivermectin that we use is we use it based on the body weight of the patient. It's not haphazard. We use from 0.2, 0.3 to 0.4, depending if they're mild, moderate, or severe, per kilogram per day for 5 days, or continue past the 5 days if they're in the severe bracket. I add antibiotics, macrolides. If they're allergic, we replace it with another in the attempt to fight the community-acquired pneumonia, which we do see. Fortunately enough, we have an X-ray unit on site and a CT scan, which we send them for, which assist in the management, whether we give IV antibiotics. So once they have had community-acquired pneumonia, we start with IV antibiotics, along with the ivermectin, the steroid, if they have shortness of breath. Some people start early, especially for the asthmatic cases. And of course, the anticoagulation for those who are at risk for coagulopathy. Patients who have a history of DVT, hypertensive patient, obese. So we stratify accordingly to the patient who is in front of us. We use in our ICU and HCU, we sometimes even use steaming menthol crystals to increase the airway and the flow of oxygen in. So based on the 18 months that I've been battling, because it's been a battle, we want to help. The private physicians want to help. The private physicians want to use whatever we have available to deal with it now. Vaccination will give you acquired immunity, but acquired immunity occurs after at least the second dose of the vaccine. If we're honest with ourselves, to acquire herd immunity will not occur until probably 6 months from now. What do? We have to manage the patient now. And we need to manage the patient with whatever information that we have, the knowledge of the corona family of virus, the availability of antibiotics, the availability of physiotherapy, the availability of ivermectin. We have to use it now. And if we are indeed serious of managing these patients, these different resources or items must be available not only to the community doctors, which already is in the community, but to the nurses, to the health aides, to the police, to the soldiers. This is not normal. And I've always correlate the corona pandemic to a biological warfare. We have to think as if it's a warfare, and our management can't be what we're used to. So we have to address it accordingly. Disseminating the resources, the little what we know of, into the every nook and cranny of Jamaica. Dissemination of vaccination, of vaccines, not only through the public sector, but the health sector, the private sector. Doctors in the private world, we give vaccine all the time. And we're not anti-vax. If you look in all of our refrigerators, we have tetanus, we have measles, we have mumps, rubella, hepatitis. We want to give the vaccines. Give us the opportunity, and the doctors the opportunity, to disseminate this to the community. Give us the opportunity to even procure it ourselves, because I know the government at times have troubles to procure the vaccine, but give the doctors the ability to procure it, and the private medical companies to procure it and take it in for private use as well. We have at least 10, 12 vaccines that are available, some of which are WHO approved and not. But all has data to suggest that it gives some level of immunity. What are we waiting on? It is clearly obvious that we have to tackle it now when it's in front of us, and we need to treat it with whatever we have available until we have enough vaccines available and everybody is vaccinated. We can argue to say maybe the present public system need to stop elective cases and increase the capacity to deal with corona cases, and then more so talk about bed numbers as opposed to a percentage. Because when you look here on the news recently, Hanover only have 11 beds. One parish only have 11 beds to deal with corona. Savlamar is overwhelmed, and most of the patients are being shipped to Cornwall. Cornwall at this present, the hospital that's available to manage the entire Western Jamaica, is in dire need of help. And that is to say, to keep it as minimal as possible. Dire need of help. The doctors they need help. The doctors, the nurses, the supporting staff, they need help. And I believe if the public, the government, and the Minister of Health approach all the private practitioners to assist in the fight, to disseminate the vaccine, we will, because we have already started the fight of treating these patients. I have a lot of success rate in severe COVID patients, not mild, not moderate, severe. When they come to you 14 days later, and all you need to do is hit them hard, hit them hard, hit them hard. Unfortunately, and like in any biological warfare and any warfare, people are going to die, but we need to minimize the casualty. And by minimizing this casualty, we need everything available to us early, very early. And that is the biggest thing. Test early and treat early, and treat with what we have until we can have vaccines available to everyone, and the boosters as well, because the science tells you that antibody levels for coronavirus of all sorts will wane. So we have to also plan after the first vaccines. What will happen afterwards? 6 months down the line, who is going to pay for the vaccines? Are we going to get free vaccines again? What is the plan after that? I want to hear about it after that. What I'm not also hearing worldwide is to talk about antibodies. How do you measure How do you know the efficacy of a virus, of a vaccine? Antibody levels. What is the next step with that? So I know I've said a lot, but I'm very passionate about it. We have lost patients, but we have saved a lot, and far a lot of patients. And by doing so, by testing early and treating early. And I must say, I want to thank Dr. Hunter for putting this team together so we can have a voice and express what we are going through. And I want to thank everyone for listening. Thank you.
Thank you, Dr. Spencer. I want to salute you for the amazing work you are doing and the difference that you're making, not only in the West, but right across Jamaica. Jermaine also has a telemedicine platform, and I salute him in particular for the success that he has received in treating the severe cases. And it's something that we need to support and applaud. Of course, we are all about one big tent, everyone together. This is the message from the independent private practitioners, the independent public health providers that reach the furthest in Jamaica. They reach the furthest in the Rio Grande, in the hills of Eldersley, in Cambridge. They reach places where government provided services are not able to reach. And so it's important to hear your voice, Dr. Spencer. And I thank you for your scientifically driven, your testing, vaccination, the high flow, your x-ray, all of these services that will help. Of course, we want to treat people early, and we want to treat them at home to avoid them progressing to hospital, where it is expensive and a bit distant in terms of how treatment occurs. But thanks again, Dr. Spencer. Thanks again. Mr. Chairman, Leroy,
Yes, I'm here.
Can we now have your personal experience with coronavirus? We know that you got infected with the virus like myself, like several other of our colleagues. And we want to hear you, not only as the physician that treats coronavirus, but the physician who got coronavirus and overcame it. And out of that understanding, you are now better able to recommend certain strategies and approach for the entire Jamaica. So, and over the world, because we have people listening in from London, we have people listening from Florida, from New York, on the platform from what I'm seeing. So this is a global audience, and what we say matter. And we have, of course, the mainstream media here, and I salute each and every one of them, including from the Office of Prime Minister. So over to you, Ms. Dr. Leroy Heyman.
Okay, thank you, co-host Roger. Yes, it's true. I had the coronavirus infection in late February of this year. I was admitted to the Maypen Hospital for 7 days. I came out and with a challenge, and I made up my mind that none of my patients will ever have to go into the hospital for treatment. What I will be saying would be a combination of what I experienced from symptoms, and also I looked at the various medications that were presented to me in the hospital. And it is from that, then I was able to build a treatment regime for myself that I utilize in my practice. And the good news is that nobody goes into the hospital and nobody have demise. So in a nutshell, I like to time the disease from the day the symptoms start. And if nobody start to have symptom on day one and then end up into the hospital on a ventilator by day two, no. We go through a series of process, and from our medical knowledge over the past 20 years, we will realize that the first 6 days, there is inflammatory reaction where various symptoms develop as a consequence of that. There's a fever, there is a cough, there's diarrhea. And when I look at the symptoms, I realized that if we can catch the patient in the first 6 days when these symptoms are just developing, then we can hit the nail on the head from there, and that will most certainly minimize hospitalization. So what takes place in the first 6 days? The first 6 days, we have a lot of inflammation going on, what is known as the cytokine storm. We have inflammation in our GI tracts, we have inflammation with our kidneys, our liver, our heart, various organs of our bodies are inflamed. And so in my practice, the primary treatment is to minimize the viral load in this stage, and also to minimize the symptoms from getting worse. In other words, to minimize the inflammation. So for the mild cases, I mean, simple Panadols can use for the very mild cases. Now, we recommend steaming, as was mentioned by the other presenters, because steaming have a way of helping to get rid of the virus from the nose and the throat, where the test is done to elicit the virus. And so we do recommend steaming along with the other vitamins that was mentioned before. If the symptoms are, say, more than just a simple fever with chill and a headache, we tend to use an anti-inflammatory. Now, there are various anti-inflammatories that are recommended worldwide. And the one that we use here or recommend here is what the other presenters have mentioned, the ivermectin. And we find if we give the ivermectin in the early stages, the first 6 days, in my office, based on their body weight, I give a start dose. And then 2 days after, I give another start dose. Then I find that the outcome is tremendous. And this, we're talking about the moderate now to the severe cases with varying symptoms. Now, in my practice, I've been seeing them in the first 6 days. I interview them. We make a diagnosis using the rapid antigen test. Once it's positive, then we assume that they are truly positive, even though the sample has to go through the national lab for confirmation. And but based on the high clinical evidence we see in the presentation, one of my key anti-inflammatory drugs is the ivermectin. And then our policy is that they go home with this treatment and they are reviewed on day 7 of the illness. Now, why day 7? We realized that during the next 6 days, from day 7 to day 13 into 14, that's when the possibility of a severe infection is inevitable in some patients, as we have already defined. Those with chronic illness, those with comorbid conditions, obesity, cancer patients, they seem to get a more severe infection. So when I review them on day 7, then we listen to their chest again and we look at their symptoms again to see if they are worsening. If there is no worsening in their symptoms, then we send them back home, we monitor them, continue their steaming, continue their Panadols, we stop the ivermectin at that stage, and then we review them after 2 weeks of the infection. If they're well, then we recommend that they take a little 2-week break, and then we get them back into their normal life activities, back into the workplace after that. Now, on day 7, if the symptoms are severe, getting worse, then we tend to add to that 2 medications. We use the anticoagulants, and we use another stronger anti-inflammatory in the form of a steroid. In my practice, I use dexamethasone. Sometimes I use a prednisone. But what we find now is that when we start these 2 medications, they make tremendous progress. And I love day 10 because I tend to bring them back on day 10, because when day 10 comes around, the smiles start to return. This is when they say to me, "Doc, I feel much better. I feel like I'm back to normal." Now, We have a range of anticoagulants that we use. We use, sometimes if the symptoms are severe, we use the subcutaneous ones like Clexane. We use the oral one like Xarelto, Pradaxa, Eliquis. And I'm mentioning their names because later on I'll be asking the government to see if they could do some form of subsidy on these medications or to adjust the duty on them so we can, the patients can get these medication at a lower price. So when we start them, this is the moderate to severe ones on the dexamethasone and the anticoagulants. We review them on day 10 and usually they are better. And then we review them again about 4 days after day 14. And by then, the good news is that most of them are better. They are almost ready to go back into their normal lifestyle activities. But as I said before, we still recommend that they rest off for 2 weeks because as I've seen for myself and the other patients, it comes with severe weakness. And so we normally ask them to go through a period of rehabilitation, physiotherapy. We mentioned various ones already. I tend to ask them to blow into a balloon. Those who can buy the small spirometers, we ask them to blow into it. And of course, exercise program. So when we do that, I have not had so far in my practice the moderate to severe cases going beyond 14 days of treatment. After that, after 14 days, I simply follow the guidelines that are recommended. We continue the anticoagulants for another 2 weeks. The anti-inflammatory, the dexamethasone or the prednisone, we stop that after 10 days, after 10 days. Now, I'm very stingy in my practice with regards to medication. I'm not one of those polypharmacy medications. I try to use a small amount of medication each time. And then on day 14, when we do the assessment, if there's a secondary bacterial infection, we would add antibiotics. We have seen secondary fungal infections at that stage. We add antifungal. And but the important thing is that some patients normally complain of tingling to their fingers and toes. So we continue the anticoagulants for another 2 weeks after the initial 7 days of the subcutaneous one. So this is the message we're saying. Nobody starts on day 1 of their symptoms and end up in the hospital on day 2. No, you have to go through at least 14 days before you reach that stage. And I want to use this opportunity, co-host, to thank the many practitioners and the frontline workers in the hospital, our medical internists, our highly trained professionals at the hospitals who have been so carefully and monitoring the patients when they go to the hospital. But we're saying to the public today, listen, even though we're applauding them for their great help, for their great care, we don't have to let the infection reach that stage. And so that's why we're echoing out the message today. Instead of saying when you have symptoms, you turn your yard, the echo today is that when you have symptoms, you go to your doctor in the first 6 days. We start you on treatment, we monitor you from home, and the good news is that the outcome is very, very favorable. I am one who went through this illness. I know what it means to have gone through the symptoms. I've seen what medications are given to me. Some made sense, some did not make sense. And I'm determined from now on to ensure that anyone who comes to my practice will never end up having to go to the hospital unless it's absolutely necessary. This is my experience, and I'm sure others will benefit from this. Back to you, co-host.
Mr. Chairman, thank you for that very, very powerful statement of fact and evidence. And we salute you. We're glad that you're here with us, a senior member of our esteemed profession. And we are humbled to have you to tell us about your experience as a patient. And from that experience, you are now able to solidly to be on a solid foundation to see how you can make a huge difference to the lives of all residents, citizens of Jamaica. So thank you, Mr. Chairman. Thank you for being one of the frontline workers. Thanks to Susan Arscott. Thanks to Dr. Michael James. Thanks to Dr. Jermaine Spencer. Thanks to Dr. Vernon Jones and several other people on the front line in the communities who are making a difference. So I think it's right now for me at this time, Mr. Chairman, to share my personal experience with treating coronavirus, which was born out of a call from my colleagues for assistance with caring for them who became ill. So my direct involvement in coronavirus really started really sad. It started with a very dear friend of mine, someone, a great botanist of Jamaica. In fact, there's a black-eyed pea that's named after him. And may his memory be not forgotten. Vincent Thompson from Clarendon, whose wife called me and said, after a week of cough medicine and battling, they were watching it. And at the final hour when I was called, he was delirious, seeing the moon, the stars, and this was not Brother Vincent. Within 12 hours of going to the Maypen Hospital, his saturation was about 50%. His x-ray was white, and you know the rest of the story. He died. I am still affected by that, still affected. It is really sad. So I made it my personal duty that I would be fully available for the treatment of coronavirus and become a member of that front line defense, that wall of defense in the battle against coronavirus. So not long after, I got a call from my colleague, 71, said that her mom had just come home from hospital following a hip fracture. Her mom is 104, and she went into the hospital without coronavirus, contracted the virus in the hospital, came home with the virus, and brought it to her mom, her daughter. So now both of them, she at 71, a physician, and the patient, 104 years old, a very senior nurse retired nurse from New York. They both now had coronavirus. So I went to their home wearing a mask. You know, I sanitized, but never thought twice. And I went to their assistance, and we started treatment early for both of them. We started medication, which Suzanne, Michael, Dr. James, Dr. Manet Arscott, Dr. Leroy Heyman, Dr. Jermaine Spencer have all testified. We started blood thinners, such as Xarelto, and some we used Clexane. We started antibiotics for my choice. That would have been levofloxacin and Zinat. Of course, it's a bit expensive. I also used dexamethasone for the diabetics. We had to be, of course, careful. So we have to add also some antifungals for the diabetics so that we don't get the black fungus, which was a big deal in India. And then also steaming with menthol crystals in particular, and backing that up with regimented oral hygiene. One of the things that have remained clear throughout this pandemic was that things like Listerine kills the coronavirus within 40 seconds of contact. There's no doubt, everyone agreed and reports that in the scientific report. So oral hygiene is extremely crucial in the fight of the successful fight. So not only do we walk around with hand sanitizer, I also walk around with Listerine. And if we Listerine 3 times a day, we will reduce our viral load in our mouth if we have it asymptomatically, but also reduce the chance of passing it on through the mask. So I treated both of my colleagues, and I'm happy to say, to God be the glory, they both are alive. They both lived. Now, a couple of days after that, say about 3 days, I started to develop a fever, 101. Now I know that's not normal for me. I immediately knew what that meant. So I got coronavirus. I didn't panic not one bit. I started the same treatment, but early. Now I'm treating myself at day 3 with the same regime I've just outlined: intensifying steaming, brushing the teeth, Listerine, flossing, as well as vitamin D, 5,000 units, vitamin C, 1,000 milligrams, vitamin E, 1,000 units, vitamin with zinc, 50 milligrams, as well as caltrate D, 600 milligrams. So we had the supplements, we have the medication, and also we combine that with rest, bed rest. You cannot be running your business or working for anyone during this time, even though you may not feel very ill. If you're mild or moderate, you must not push yourself. You must rest. That's very, very important. So all 3 of us treated at home, and I treated at home early with ivermectin as well. It's all a part of the arsenal. And we were able to say, when my oxygen, we also used an oxygen saturation meter. Now from March 2020, when I suggested to the CEO that every family must have a pulse oximeter. Every family, the CMO of Jamaica, we recommended this. Every family must have a pulse oximeter, and the pulse reading must be 95 or higher. And you can use a spirometer, but you can also use the pulse oximeter. You can deep breathe to get your numbers up to 99 and 100. So this can be an incentive spirometer as well. We suggested also that every family must have a non-contact, a contactless infrared thermometer. I've had one of these in my practice for about 8-9 years now. And so every family must have this.
In the name of Jesus, Lord, we thank you for releasing your knowledge in this place, precious and golden.
Can we have our mics muted, everyone? Thank you. Okay. Right. So every family must have a pulse oximeter, and we call on the government. I see Naomi Francis is here, and I welcome Naomi from the Office of the Prime Minister. Welcome, Naomi. And we call on the government to make pulse oximeters duty-free, free of GCT, free of every tax possible, environmental tax, so that we can get their price more down to $2,000 or $3,000. As it stands now, we're looking at $4,000 to $7,000 for a pulse oximeter. And for infrared thermometer, you're looking probably about the region of $10,000, $12,000, $8,000, $9,000. It's very important that the government partners with us. Can I ask everyone to just mute their phone, mute their microphones? Thank you. So with this arsenal, we already had, I was walking around a pulse oximeter from March last year. So when my oxygen saturation fell to 79% at home, not 1 minute did I feel short of breath. Not 1 minute did I feel like I was in distress. And that is the danger, because your pulse oximetry can be low. Dr. Leighton Winter, welcome. Dr. Everton McIntosh will tell you that there are people walking around like myself with saturation so low, and they have no idea. And that's why you suddenly crash. But for me, I was constantly under monitoring, and I saw that saturation of 79, constantly monitoring my saturation. And immediately I steamed. Immediately the saturation came right back up to 99%. So we were on the ball. So again, it clearly demonstrates that early treatment works. And we want to emphasize that to each and every household in Jamaica, that early treatment is vital in the successful battle against coronavirus. I've treated close to 100 patients. I've treated a journalist yesterday who both has coronavirus and is fully vaccinated. I've treated several people, and I must say, I've not lost a single patient, including myself, because early treatment matters. Yes, maybe they say I was mild, but listen, my saturation fell to 79%. Now that's significant. And because I was under early treatment and monitoring and having my family at home to help me, It was important that we had that early critical monitoring and early intervention to get a successful outcome. Antibiotics, blood thinners, steroids for inflammation, ivermectin, viral medication, remdesivir, if possible. Now, we can also administer things like monoclonal antibodies at home, like what Donald Trump got. Now, I want you to pause and think about this. Donald Trump got coronavirus last year. President Bolsonaro got coronavirus last year. Prime Minister Boris Johnson got it. They were all treated early. And like Donald Trump, he was practically treated at home. When he checked into the Walter Reed, it was in the suites. And that was like a home environment. And he just spent a day or two. And he was back on the job on Monday because he had a campaign to win. Early treatment works. And I want to tell you today that it matters to start early treatment, not just stay home and watch, but stay home, monitor and treat. It is much better if we can treat you at home. And the virtual platforms such as Get Well from Dr. Jermaine Spencer and others, iDoc, Dr. Shirley, a lot of other telemedicine platforms. You can treat people at home safely, a lot less expensive, it's more cost effective, and you can get the dignity, the privacy, the comfort of being treated at home. I have applied a blended approach where I go to some homes, but the majority of homes I'm now able to treat virtually. Once everyone have this little tool, a pulse oximeter, which I commended again to the government last year. But I am happy that the word is getting out that everyone must have a pulse oximeter and your oxygen saturation must be above 95%. I needed no oxygen, none whatsoever. So I was able to treat at home. I was able to treat my colleagues at home, and several other patients have treated at home without the need for oxygen. Steaming, practically no hospital system. And I'm glad to hear Dr. Spencer is using steaming, but steaming is absolutely critical in the fight against coronavirus. So I'd like to also recommend strongly that steaming is a very important tool in the treatment of coronavirus. I steamed, got better. My SAT was 79, I steamed, and it went right up to 99. Steaming matters. You coughed some really awful dark stuff. You're living in a city, you see that you are inhaling a lot of exhaust. So it's really important to steam. So the sum is early treatment matters. Early treatment is important. We want to treat early at home. We want to treat everyone at home. We are inviting everyone to go out and be champions. Go out and say to your neighbor, to your friend, get a pulse oximeter. Monitor with a pulse oximeter. Do not rely only on how you feel, because how you feel will be misleading. Early treatment matters. Early treatment at home is the best formula. We can treat coronavirus early, and by so doing, prevent the deterioration to more severe disease. I have been nominated by my colleagues to become the MAJ president-elect for 2021. We hope the campaign will be successful. This, of course, is a greater call. I'm humble. Coronavirus is not these are not ordinary times. Students, children have paid a tremendous price. 121,000 have been left without education when practically no child has died. We heard from the Prime Minister on Monday that it's likely that some will be permanently damaged in their educational future. And we call on the Prime Minister to have inspired leadership. Inspired leadership. In the 70s and 80s and the 90s, nurses and teachers were paid to go to school. Education for them in the nursing field was free. I suggest that we pay for those children to come back to school, to find the resources. $12 billion was spent trying to isolate the coronavirus in 2020. Now we know that's the virus is everywhere. So the will can be found. So again, I'd emphasize, early treatment matters. Early treatment at home is the best formula. The treatment package, once you have a doctor, you must have a public health giant, whether it's a private practitioner, meaning general practitioner, or a government practitioner. I'm also calling for a therapeutic line, which is free of cost. The patients I've treated were all treated free of cost. I've treated colleagues, I've shared my treatment formula freely with anyone who asked. And I can tell you that we have had 100% success. And we are saying to the government, not only to stay home and watch, but stay home and treat. We are treating most coronavirus in Jamaica by now. And this is something that the authorities need to hear and need to understand. So, having said all of that, I hand you back over to my chairman, Dr. Leroy Heyman.
Thank you very much, Roger, for sharing your personal experiences and echoing the cry again that early treatment, in-home monitoring does reduce hospitalization and indeed long COVID complications and indeed death also. We have said a lot this morning and into the afternoon now. So at this time, we stand by ready to accept any questions that you may have for us. Please identify yourselves as you come online. Questions?
Hello, good morning. Good morning,
Good morning or
everybody.
afternoon.
Could I just, because we have the media here first, can we get I'm sorry to say this, but can we get the questions from the media first, because they may have other engagements too. So can we just have the media questions first? So if you're from the media, let's have your question first. Are you from the media, my lady?
Your voice, excuse me.
Hello. Okay.
I'm from the media. My hand is up. I think maybe you could use the raise hand.
Right. Let's all try and use the raise hand. Is that Janet Silvera?
Yes.
Okay. Hi. Welcome, Janet. Which media house are you from, please?
The Gleaner.
Okay. Thank you. I appreciate you being here. Go ahead.
Thank you. I wanted to find out why the government has not given its approval. Why do you think the government has not given its approval as it relates to ivermectin? 1. 2, most of the doctors who have spoken here and have said that they've had the virus, can you say if you have all been vaccinated or you have remained unvaccinated? And if you have remained unvaccinated, why? What's the reason behind it?
Okay, Dr. Heyman, you wanna take that one?
Okay, well, all right. First of all, I am not vaccinated. As I mentioned before, I got the viral infection in February of this year. And based on the studies that we have looked at, my immune system, I've acquired natural immunity. And so there is no need for me at this time to take the vaccine. Later on this year, I plan to do an antibody titer test, which is a very specific test to, tell my level of immunity. And if the need arises, then I have no objection in taking the vaccine. Now, the government, there was a hesitation from not accepting ivermectin because we rely a lot on the World Health Organization as our key guide to make various decisions. And for a long time, the WHO, their decision was pending. And so, but now we're happy that in recent times that announcement has been made for the importation of ivermectin. So those who have had it, in spite of the WHO recommendations, well, still pending, we have used whatever little is available. So That's the reason, I think.
And can I just, Suzanne, do you want to comment or Michael? Suzanne, Dr. Minot R. Scott, Dr. Michael James? Okay. All right. From my personal experience, certainly, and certainly my colleague who is a doctor, when we evaluated our antibody levels, they're well above 90, very high levels. So natural immunity, actually, can you imagine taking the whole agent into your body? Natural immunity is still very important in terms of protecting you against the ravages of the virus. Certainly, the WHO also guides that people who are actually having the coronavirus and the infection must not take the vaccine whilst you have it. So we want to also pause and remember Michael Shaw, one of the great journalists of our times. And the situation surrounding him, he actually had the coronavirus and took the vaccine at the same time. And death followed subsequently. So we know there's a hyper-inflammatory pathway, and the WHO makes it quite clear that you should not take the vaccine whilst you have the coronavirus infection. And then we have not heard much about antibody testing. In America, it's widely available. They have kits, they have home kits. And I think there are doctors in Jamaica who have those kits. Dr. Vernon Jones, I think, also has that kit. The antibody testing, that if your antibody levels remain high, then you remain protected for a bit. And if you see where your antibody levels fall, then you may need to, then at that point in time, take the vaccine that's available for you. We recommend the vaccine, but at this point in time, because of the emergency use authorization, we do not recommend mandating it. Other journalists?
No, I want to find the ivermectin question.
Oh, right.
The ivermectin question was not exhausted.
Let me speak about ivermectin. Again, we used it. I use it on a 104-year-old nurse. So we recommend it strongly. The WHO said that you must use it in a setting of where you carefully collect and collate and see in the setting of a study. Well, every doctor who uses it, therefore, then we carefully document and collate the cases that we have used. I myself, and then that provides a body of evidence on which to go forward. But when you're using several different things to treat the condition early, it's hard to necessarily say for sure where the benefit is derived from. But we certainly see ivermectin, like we see vaccines, as part of the solution. There's no magic bullet. If you look on other countries who are fully vaccinated, like the UK, with death rates of 200 per 100,000, and Jamaica and Haiti, who are unvaccinated, with death rates of 40 per 100,000 and 5 per 100,000 population, you realize that, well, you'd say, well, the vaccines definitely are not completely protecting the UK. We recommend a vaccine, but we don't recommend the mandating of it.
No, my question really is ivermectin now available to us in Jamaica?
Absolutely, it is
readily
available.
No. Is it readily available? Is it being imported with the blessing of the government?
That's a key question. LASCO, I think, has a license, LASCO Medical Distribution. They should have imported it last week, Thursday or Wednesday. From what I'm hearing, that their importation price, because they got it from the wrong supplier, so their cost will be higher than the black market price, so to speak, if that makes sense. So we need to make sure that LASCO pays no duty, nothing at all, in bringing their product in, or else that's going to make it, so even though it's readily available, quote unquote, it's prohibitive in the cost. And so the message must be the oxygen saturation, minimum cost, blood thinners, minimum cost, and ivermectin, minimum cost. Janet? Okay.
Thank you very much.
You're most welcome. Any more journalists? Can we have the questions from the journalists first? Because I know you're on multiple stories. General
Corey Robinson would be next.
Corey Robinson. Okay, Corey Robinson. Go ahead. Are you from? Just introduce yourself and just say where you're from.
Good morning, members of the forum. My name is Corey Robinson from the Vienna Company. I have a couple of questions for Dr. Hunter. But let me just follow up a question that my colleague asked, just for clarification. the doctor prior, I can't recall his name. He said that his reason for not being vaccinated was that he had COVID-19 before, correct?
That's correct.
And that
Yes.
he recovered from it, and he has developed a natural immunity.
That's correct.
So does that suffice as argument for persons Jamaicans who've had COVID before and who the government are also targeting to get vaccinated? Would he advise these persons to rely on the natural defenses as opposed to get vaccinated? Does he advocate for vaccination?
Well, I think what he said is quite clear that vaccination definitely is recommended, but we're also saying that there is natural immunity. And if you test your antibody level, you can see the antibody levels against the same coronavirus. And if antibody levels are high, then there is no need. Over time, the antibody levels fall, and then there is a greater need. But what is clear that within, say, a 2-month period, 3-month period after the infection, you should stay clear of getting vaccinated whilst they're infected because of the hyperinflammatory state that will naturally follow if you have the infection as well as have the vaccine. So that is the message. And the WHO is quite clear that you must not be vaccinated at the same time you have the illness. And so you mean—
Yeah, man, that is clear. I'm talking after you've contracted the disease and
right.
recovered.
So this is new information for you. If your antibody levels are high, your antibodies are the natural thing. That's the objective of the vaccine, to get your antibody levels up. So if your antibody levels remain high after you have the infection, there is safety in that. So you have to keep checking your antibody levels. It is the same situation that if you are vaccinated, Corey, you will need to check your antibody levels later on, because we know from what you are hearing from us, several people fully vaccinated are now coming down with this new variant of coronavirus. So they're fully vaccinated, but yet they're still getting not just asymptomatic infection, they're getting symptomatic infections. But the beauty about the vaccine, it reduces the severity and reduces the risk of hospitalization and death, but it does not remove it from zero. Yesterday, 100 people died in the UK. On average, for the past week, 100 people are dying in the UK from coronavirus infection, and a high percentage of them are fully vaccinated. So you have to understand that full vaccination does not completely protect you. And just like having the infection 6 months ago doesn't mean that I couldn't get the infection in the next wave in December when the virus changes. So it's all about your antibody levels. So we call on the government to make antibody testing readily available, remove all the taxes associated with it, so that we can get a better picture of saying who is really in a safe zone and who is not. Dr. Heyman, you want to add anything to that?
Yeah, I just want for clarification to let him know that I got the infection before the vaccines were rolled out. So it's not that I neglected the vaccines. I got the infection, I think, about 3 weeks prior to the rollout of the vaccine. And so I believe my natural immunity is of good standing. I mean, as I said before, I can confirm that with an antibody titer test. And if the need arises, then certainly, yes, I will go for the vaccination.
100% embrace the vaccine.
All right, Dr. Hunter, I'm real quickly, because I know there are more learned persons I would love to hear from who are in the field with questions. But you are aspiring for MAJ president, right? There are several issues within the
MAJ president elect. Right. So that's going to run for 2 years.
My apologies. But I just want to hear from you, because there are several issues facing the healthcare workers as it is right now. Among them being lack of jobs for one, and the direct threat of COVID-19. What is your pitch? What is it that you're bringing to the table as new MAJ president?
Sorry, Rory. I'm sorry, I will not allow him to answer that one, because we are having an election with 2 candidates that we respect both of them, and the other party is not here to share an answer to that similar question. So I would appreciate very much if we put that question on hold. If we do get a debate in for both of them, then I would highly recommend that question. But for now, I'm asking you kindly to put that question on hold.
All right, no problem. No problem. Moving right along, Dr. Hunter. You said in December, if I get it correctly, you can correct me if not, that the country was overreacting to this COVID-19 pandemic. I'm just curious what caused the about turn now that you're obviously exiting. What's the basis for that?
Well, what we're seeing here is not what we saw in last year. Last year we had 10 patients died and the whole country was locked down, ports, everything was locked down. We have reacted more strongly last year with 10 deaths than this year with over 1,000 deaths. I think we have to find the right balance between balancing lives and livelihoods. The reality is now we are 18 months on and we have learned a lot. We have seen people die in Jamaica and we have learned perhaps why they have died because early intervention was not applied. But regardless of that, when you, and I gave you the gentle figure, like Haiti is 5 per 100,000. Haiti with a population of 11 million has only seen 560 deaths from COVID. Jamaica has seen 1,200 deaths. When we do population adjustments, the UK has 200, approximately 200 per 100,000 deaths, 5 times the death rate as Jamaica. So we have to recognize that we in Jamaica and in Haiti, we have been relatively spared compared to countries that have a winter. In December, we don't have to look forward to frozen roads and frozen streets and locked inside with heating on. So the relative protection is definitely clear. But the virus is mutating. It has mutated already and will mutate again. And when it mutates, it becomes more able to survive within the environment that it finds. So it's not necessarily that the Delta virus is going to come here. It's going to mutate here. The government, we call on the government to have $60 million injected quickly so that we can do our own local variant testing. Because as it stands now, we have to wait 2-3 months to get an answer to see what variant is operating. So we recognize the challenges, but we also look at the comparison. And Jamaica does not belong in the line of severe outbreaks. Minister Desmond McKenzie told us that our deaths in our care homes are just 11 out of the couple hundreds in our care homes. Now, everybody will agree that our care homes are very decent care homes, but you know, they're not Rolls-Royce care homes. Yet Rolls-Royce care homes in England or in Canada, they have seen thousands of deaths. Why? Why is there a difference? Why is there a difference between the elderly in our care homes, the golden age homes, and the elderly overseas? So I leave that for you to try and balance.
Thank you very much, Dr. I leave the floor open to your colleagues who I know will have more detailed information on the situations. Yes, thanks much.
Thank you.
Thank you.
Anybody else?
Questions? Any more questions from the media?
Shamela? Okay. Can we move on to you're hearing William Reynolds? William Reynolds, can we take his question? Or we can, Janet's hand is still,
yes.
Still up. Wait, sorry, William. Sorry, I'm gonna mute you, but I see Janet's hand still up. Can we get Janet? Okay, she's gone. Okay, yes, William, I'm gonna bring you back in. All right, get unmute now, William, and ask your question.
All right, thank you very much for giving me the opportunity. My question, I'm from Canamed. We're local cannabis producers. I'm curious, I haven't heard if any doctors have been trying CBD formulations for the inflammation.
Ganja.
Ganja has been the healing of the nation. But on a serious note, CBD, especially and high CBD, has been found to help with the inflammation and that all that inflammation happens especially in the first few days. But is it something that doctors are actually looking at, or has anybody been trying it, or has anybody considered it? Thank you.
If Jermaine or
so far, we're just now seeing the studies coming out on the marijuana usage, and the truth is that we do not have sufficient evidence. I'm not sure if anybody have used it. I know certainly I've not used it in my practice. I just saw 1 or 2 studies just coming out. But based on the properties of the marijuana, I'm sure if it can offer good reason to think that it can decrease viral replication, decrease inflammation, then I'm sure that it will be introduced as part of the medical management soon.
Not necessarily marijuana. I mean, let us distinguish between what we're talking about. We're talking about no THC or very low THC, so no psychoactive effect is very important. There are strains and varieties with higher of those cannabinoids that will affect those things. Like there's THC has its purpose, but specifically using those strains or extracts that are high in other non-psychoactive cannabinoids.
Can I?
Well, yeah. Okay, go ahead, Roger.
Right. Because I've been monitoring that situation. The reason why we are seeing some positive results from the cannabinoids and the THC relates to the fact that it's a steroid. It's a cannabinoid. It's a steroid compound, and we know steroids help. They do. Bill Gates sponsored a study that showed dexamethasone helps. So dexamethasone is in that same league. That is not far removed from the cannabinoids. I've spoken to Dr. Lisa Kerwin-Dawes, a well-respected, very senior physician based at Maypen Hospital. And from the information that she's seeing is that patients who particularly are using the product, they're seeing less severe COVID amongst her population. But I'd certainly invite you to reach out to Dr. Lisa Kerwin-Dawes, who I'm sure she'll be available to share her experience with the nation. But I think there is merit in trying to find out how can we get everything into the tent, what benefit can we derive that's out there that we're not learning, and how can we share learning. But we know smoking is generally a bad thing. But having said that, we also recognize that marijuana and cannabinoids and all that could certainly help with the inflammatory response that you get with COVID. Okay, questions? Let's keep
I was just saying, remember that smoking is not the only way to take cannabis.
Absolutely right. That's why I was careful
Just
not to stay there. I didn't want to stay there, but you know that in the local application, a lot of people do prefer that use. And I think with Dr. Kerwin-Dawes, when she was speaking with me, that smokers of marijuana, she's seeing less. But I'd certainly invite you to speak with her and the media to also approach her on that matter. Garfield, can we get Garfield David? Okay. Garfield?
Hi, good afternoon. Can you hear me?
Yes, good afternoon.
Yes, we can.
All right, great. So question for all the presenters, really. How did you come across ivermectin in the first place?
Dr. Michael James, you want to take that one? I see you back in. How did you come across ivermectin? So I'm just going to unmute you and ask you to take that question. How did you come across?
Thanks for the question. Actually, I was online and researching how best can I treat my patients, and I just came across an online forum that had been using this drug very early in the treatment protocols. After many things have failed and people have been investigating various modalities of treatment and finding out how this virus works. But this became interesting for me after I saw this forum with these doctors. And then a lot of other doctors started using it as part of their regime, with, of course, many other little symptomatic treatments to support the person's, to allow the person to feel better, like Panadols and vitamin C and vitamin D and various other modalities. So when I started it, when I saw it, I said, well, this must be something potentially good, because doctors have been using it and it has been working for them. And so I took the challenge up. I just ignored WHO's recommendation as saying they have to be hospitalized, oxygen, because people are dying. And although the science is not clear yet as to how it works, symptomatically, it does make them better. And in 3 days, clinical improvement is there. So I took up the challenge and started people on it. And I mean, when a person comes to your office and they say that they're dying, and Lord, what am I going to do now? Desperation sets in, and they tell you that, and you're the last person they're coming to. What am I going to tell them? Go and die? No, I can't tell them. So I started using this experimentally and found that it works. A lady who was 86 years old, the first presentation was a lady, 86-year-old. She has abdominal aortic aneurysm. She's hypertensive. She is diabetic. She's 86 and she's frail, a frail old lady. And I put her on the ivermectin with the other symptomatic relievers. And in 3 days, the lady called me, she is much, much better. I was surprised. And then I tried it again on another 78-year-old lady who came in with the same symptoms. I tested them afterwards and they were positive for COVID, all of them. But when they came initially with the symptoms, that's when I had to throw them on ivermectin. And this other lady did well again. And I said, something must be good about this thing here, because they're getting better. So when I started that, I started putting people who were coming to me, early symptoms, and I just put them on it, and every one of them got better. And the time frame is about 3 days. That's what I can say. So this is why I'm saying, why doesn't the government just allow us to import this thing? And anybody who has a fever, we have it as a backup. Nobody will end up at the hospital because they all have this medication to kill the virus. As I said, the science is not there yet, but I'm sure they'll discover it somewhere along the line that it does work. So that's my experience in this.
Thank you, Michael. So is Suzanne here? Suzanne, Dr. R. Scott, Maynard R. Scott? She's still with us? Okay. Has that provided you with a solid answer, Garfield?
Yes, thank you. And I just have to say, like, this is because of the nature of this thing and the different opinions and stuff that are out there. And like you mentioned, the WHO is really sleeping on it. Make a big stink about it on social media. All of you, I know you busy saving lives, but do find the time to get the word out there that way.
What I'd say to that is to also remember it's not a magic bullet by itself. It's a part of the arsenal. And this forum is particularly centered around alerting everyone that early treatment works. Stay home and watch is not enough. You need a pulse of
exactly.
Right. So early treatment works. It reduces hospitalization and it reduces death. We have proven it over and over again. Thanks.
From my point of view, Roger, I mean, a lot of articles started to come out from doctors in the US and Australia earlier last year, somewhere around maybe April into June. And my curiosity, I mean, drive me to study exactly what they were saying about this particular medication. And there are two things I believe that are relevant to the treatment. One, the ivermectin does decrease viral replication. That's what came out from the studies. And two, it's an anti-inflammatory. And we have had local speakers here in Jamaica. Some of our surgical consultants have been presenting on this and highlighting the benefits that we get from it. But these 2 points, the anti-inflammatory and the fact that it decreases the viral replication, were 2 significant things for me. It was presented to me in the hospital. I tried it. I'm still alive and well, and I decided that, as Michael mentioned, I took it for about 5 days in the hospital. And by day 5, day 6, I was feeling much, much, much better. So since I came out, I decided that, look, I will do my own clinical trial on the moderate to severe patients. We start them, as I said, early in the first 6 days. We give them a start dose based on their body weight. I give them another start dose 2 days after, and the outcome has been tremendous. Any further questions?
Yes, I have a question for James, Michael James.
Yes.
I would like his opinion on what he thinks, if he thinks less elderly persons could have died if we had jumped on ivermectin long ago. In other words, we have a lot of elderly people who have died as a result of COVID-19. Are you of the opinion that had we jumped on ivermectin from very early in the day, many of those lives could have been saved?
Hi, Roger.
Yes.
Yes, Michael, you're asking a specific question.
Right.
Saving of lives. I get the impression that's yes. That's a definite yes.
Yes, that's a definite yes. I think that is what I'm trying to advocate here. That's what I'm trying to say here, because if you have this drug available and you have seen the efficacy or how it works, and it works nicely, and it has been around for donkey's years, it has been around long, it has been shown that it is proven to be a minimal side effect. Very good, effective, minimal side effect. And if those people were placed on these medications early, this is what I'm saying now, have it available as prophylaxis. So it is there available. Person has flu-like symptoms, they run to the pharmacy or find a doctor, prescribe it, calculate the dosage, give it to them. What else can we do? It's protection here. They will get their own immunity, and they will get their own acquired immunity because of the infection. But again, you want to avoid the symptoms and the hospitalization. This is where it comes in. And I'm sure the persons who I've seen and treated, they would have gotten worse. And their relatives in England and wherever they're calling from would tell me that, doc, they're dead now. You see, this is a fear that people have, Fear has been placed in people's minds and hearts, and everybody's afraid of COVID virus. So every time anybody gets COVID virus, you think about death, and this is what's happening now, and everybody's panicking. So if we have this available, it will be a go-to for us, and we can always put it in the formulation and allow people to live, and say this is it. Can
I just add to that? Sorry to cut you, Michael. I just got a prescription here on WhatsApp, and we're looking at $500,000. It involves remdesivir, Actemra, which is a monoclonal antibody. Now, if we can use ivermectin, along with antibiotics, steaming, etc., and much more affordable, then we see no basis on which not to have it available. It is a part of the solution. But we can't run into monoclonal antibodies when people are on a ventilator. Every day I get questions. People, doc, do you have any Actemra? Do you have any remdesivir? Every single day I get these questions. But that is like the end hour. We need to look at the early treatment, Janet. and including ivermectin. And the prophylaxis, you journalists have go everywhere in Jamaica. You're constantly being exposed. You need to add your personal professional position regarding ivermectin. Sorry.
Dr. Hunter, are you saying that persons with COVID who are using those other are spending up to $1 million for treatment?
More than that, Janet, more than that. You have to.
Once they go private?
No, once they go public within the government. The government doesn't have monoclonal antibodies to give you. It's not free. Actemra is not free.
Mm-hmm.
So these are hugely expensive. Remember, you're in a government facility. Yeah.
Mm-hmm.
Very few, and I salute Dr. Jeremy and Spencer for having a highly critical HDU, ICU that treats coronavirus. But 99%.
Ask Janice to turn off her
yeah, 99.9%. Janice?
Mr. Bartley?
Sorry, yeah, 99, sorry about that. 99%, Janet, you need to listen carefully. That if you're in KPH ICU or UHWI ICU, they are not going to provide certain things for you. You have to go out and source it. Every day I get people coming to me. I deliberately didn't speak about the monoclonal antibodies. Donald Trump got the monoclonal antibody, got everything. He got it early and he quickly got over everything. He was back at work by Monday. I distinctly tracked that. So early treatment works. Now, I have treated many patients with ivermectin, with Zithromax, with Xarelto, with blood thinners, with steaming, which gives a bill of most times less than $100,000. And they have all lived. Early treatment works. We have to get this clear. Early treatment in your home works. I've given Actemra in your home. I have administered intravenous in your home. The key is early treatment, early monitoring. We can argue, okay, you should use ivermectin, you should use remdesivir, you should use this, or you should use that. But the key is have early interventions and have your pulse oximeter. And please advocate, lend your voice to these tools so that the prices are lowered.
Thank you.
Thank you.
May I
Zara,
ask a question, please?
yes, Zara, I'm gonna bring you. Wait, who is this?
It says Ethan Lance Williams, but I'm actually his mother, so I'm not the press. Or
okay, I'm just gonna ask Zara Burton to come in. She's from the press, so I'm gonna allow Zara to ask her question first and come back to you, Ethan. Hello, Zara.
Good afternoon, everybody. Thank you, Dr.
Good
Hunter.
afternoon.
All right, so my question relates to ivermectin, and I have gotten a forward. My problem is that I can't tell you the source of the forward, so it could be misinformation. Okay, so I want to make that clear. But one of the forwards said that in his patient, one doctor was saying that there were liver.
Can you hold on? Can you hold on a minute, please? Let's mute that person, Roger.
So exactly, feel so. I never know me have them feeling.
Okay, Paul, can we mute? All right. Sorry about Zara. Please proceed.
Yes, I was saying that I got a forward and it could be misinformation, but even though it's misinformation, can I just maybe get clarity from you guys? You can debunk it here. Ivermectin's use, according to this forward, was tied to liver failure in some patients who eventually died. What have you been seeing in terms of liver damage, if anything at all, related to use of ivermectin?
Okay, can I take that one first? I have used ivermectin and checked my liver enzymes perfectly fine, absolutely no evidence. I treated a 104-year-old lady, no problems. 71-year-old doctor, no problems. Ivermectin is not new. Coronavirus is not new. Ivermectin has been around for over 40 years. There are less complications from ivermectin than other new treatment modalities. it's very, very safe. In fact, its safety profile is better than the safety profile of the vaccines. So ivermectin, we just haven't seen it, both as a patient and in treating patients. You just haven't seen that, Zara. But we're welcome for people to report that. It has to be more than just a forward. We have to see the enzymes, we have to see the evidence that, in fact, that their liver have failed or their livers have failed.
You must also be mindful that ivermectin is a Nobel Prize winning drug.
Is that Dr. Spencer? Absolutely. It is. Thank you, Dr. Spencer. Thank you for pointing that out.
This is a drug that has severe safety profile, a high safety profile, and it has won many prizes on an international scale. And everybody can Google and see it for themselves. As a matter of fact, I'll tell people Panadol has far more toxicity if overused than ivermectin.
Every day.
And it is available over the counter.
That's true.
When we had the chickpea outbreak, we had some patients who had liver toxicity from Panadol. So we must be mindful that yes, anything can create toxicity, but it's in terms of under medical supervision, and of course, under follow-up care. Simple as that.
Okay. Janet, you wanna
go ahead?
You wanna come back again? Yep. Go ahead.
Okay, thank you. I'm the mother of 2 young children, and I just wanted to know if any of these persons that any of you doctors have treated with the ivermectin and the other support treatments. Any of you ever treated children below the age of probably 11 and below?
Okay, speaking for myself personally, no, because we have not had any symptomatic COVID at that age. Dr. James, go ahead. Michael, unmute for us, Michael.
And I mean, for me, we have children. There's no issue with children. The children are fine. Under 18, they get flu all the time. They don't even realize a bit of runny nose. They move on same way. They're very active, you know. So for the children, there's no need. There's really no need. And I mean, prior to this pandemic, we were worried about the asthmatics. But once the asthmatic take the pump and the steroid is actually shown to prevent the COVID pneumonia.
That's correct.
And that's the big reality. And I mean, and I keep on saying it, we should be governed by facts. We should not be governed by emotions or forwarded messages. And that is important. Facts. What is the facts of this virus? What is the fact of the medication that we have available to us? What is the fact of the small resources that we need to be available to every living Jamaican here? And that is the most significant thing. And we have to take that point off.
I asked because I'm almost sure early on in the reporting of persons dying from COVID, I could have sworn a child was listed.
Yes.
So I was wondering if the same methods that you're recommending for adults, if I suspect my child is having these symptoms, is it that it will work for her? Are you prepared to say
yes,
administer the same things?
Ivermectin has been used in children for like river blindness and other things. It's been around for 40 years. Its safety profile is incredibly brilliant. It's absolutely safe. Now, we have not found the need to be treating children with COVID because they are pretty much asymptomatic. When Minister Tufton commented on the children who came into the facilities, it was a question whether or not they really died from COVID or they really died from their other severe underlying problems. So COVID is not killing children in Jamaica in any significant amount. So there will be no need to worry about that. Dr. Heyman, you want to add to that?
Well, I mean, to complete the answer of her question, I mean, we suspect that the Delta variant is on board. And one of the strong points for that is that the younger generation, including children, I mean, are going to be affected. So to complete the answer, I would maybe discuss this with our professional pediatricians, and we will see what is their take on it. But so far in my practice, I've not had the opportunity of treating any pediatric patient with ivermectin.
Thank you, Dr. Heyman. Can I get Selborne? Selborne, can you unmute and get your question? Selborne Webb, good afternoon.
Yes, sir. Thank you so much. Good day to everyone.
Good day.
My question and concern is that since it is clear that one should not be vaccinated whilst having COVID-19, we are being encouraged now in Jamaica to vaccinate, and we are on a drive. How is it that we can be assured that we're not having an issue because you're not tested before you're vaccinated, you're not required to bring in a COVID negative test or anything, you're turned up and you're vaccinated. So I just need some clarity and assurance on that point. Thank you.
Thank you for that question.
Thank you for that question. That's a very excellent question.
Chairman,
especially at a time like now when we are seeing a rapid increase in the number of cases. I actually had a discussion with my MOH in Clarendon here a couple of days ago on that. And the thing is, there are some people who are going through the incubation period, which can take anywhere up to 10, 14 days. So when they get a questionnaire at the public health facility for the vaccination, they might respond in a negative with negative answers to symptoms because they're going through the incubation period. I actually had one patient in my office a couple of days ago with a similar thing. He apparently the infection was coming on. He got the vaccine and he was getting what I consider a more violent reaction. So the solution I was suggesting to the MOH for my parish was that, look, other centers of the world, if they're unsure of people going through the incubation period with no symptoms, then we will have to try to introduce the antibody titer testing to see if perchance the exposure are triggered off immune reaction. And if it does, then we would highly recommend that they do not take the vaccine if that is so. So antibody titer test is pretty expensive. I think it's around maybe 6,500 to 7,000 done at the university hospital. But other centers in the world like Canada, a couple other places are doing it. So I don't know if we'll find the resources to do that here.
Thank you so much. Thank you for your response.
Okay, thank you. Can we have Gauntlet Sinclair? Gauntlet Sinclair?
Yes, thank you very much, doctors, for your presentation. I learned a lot. My question is, what recommendation would you make for a pregnant woman? Would you encourage them to take the vaccine at this time?
It's a very good question. I'm sorry, doctor, I've spoken to some very senior, well-respected OBGYN. I think because we have to particularly think about the unborn baby, that there may be challenges there. We can't have a platform right from where I stand to strongly recommend a vaccine in a pregnant lady. I think in the United States, they have studied within the pregnant ladies, but I would have to deflect that question to a consultant OBGYN who would have had to encounter that problem and see how to treat with it. But I couldn't provide a proper answer at this point. Anybody else? Dr. Michael James, Dr. Jermaine Spencer, Leroy?
Well, the Royal College, I think, is recommending Pfizer and Moderna. They're not recommending, which is what we're predominantly using, because there's a clot issue associated with the AstraZeneca. But again, it's a risk versus benefit situation. And again, it's still early days. Let's just put it that way.
Thank you. Thank you.
Yes, I have a follow-up question. The follow-up question has to do with ivermectin. Is it safe for pregnant women?
Jermaine, you want to take that one for us?
To my knowledge, yes.
Yeah, it's been around for 40 years. So
Right.
Actually, actually,
I-
I'm no doctor, but I have been researching this very carefully for my daughter who is trying to be pregnant and is nervous about taking the vaccine while she's trying to be pregnant. And ivermectin, the one thing, it's a very, very safe drug, but the one thing, it's not recommended for pregnant people. I can safely say that you can check it out. I have been researching this very carefully because I would really want to say, yes, it is, but all the research, although it's extremely safe, not for pregnant women.
It depends on the stage
So,
as well.
Sorry?
Jermaine,
it's risk versus benefit, which is what I'm saying to you. Risk versus benefit. Risk versus benefit. And to my knowledge, this is a category B medication. I need to double check the category. But once you're about in a category B, it is safe in pregnancy. If you're a category C, you use it under the advice of a physician.
Right.
So it's a matter of the risk versus benefit. So if
Jermaine,
you have a pregnant lady,
Jermaine,
yes?
can I ask a question just to reinforce something? Jermaine, you're a consultant obstetrician and gynecologist. What's the impact of COVID on pregnancy?
Correct.
What's the implication of COVID during pregnancy? Is that a severe category? Jermaine?
If it depends on the severity of the COVID illness on the person. I mean, with a pregnant mother, depending on the trimester that she's in, she has a mass in front of her that she already has compromised lung volume or lung capacity. So yes, it is a concern. Am I seeing it? No. Is it available? It is happening here? Yes. We can't ignore it.
In pregnancy, yes.
It's there, and you have to look at it in terms of, okay, what is the risk of dying by a clot in pregnancy? What is the risk of dying with COVID in pregnancy? What is the risk of dying of allergic reaction in pregnancy? So it is going to happen, I am sure, but in terms of, is it significant for us to be panicking about or not use it? Then that's the question I personally can't answer without having the evidence in front of me.
Thank you, Jermaine. Can we move on to David Hansen? Your hand.
Okay, thank you very much for your responses.
Thank you. Thank you for your, David, can you unmute? Okay, go ahead, David.
Yes, my question thanks for putting this on and having me put forward some questions. My questions are two. They have to do with the protocol that was outlined. From what I understand, Dr. Heyman is using 2 stat doses of ivermectin. Is that oral or parenteral? That's
oral.
Well, what is that you're using? It's oral.
Absolutely.
Okay.
Oral.
You spoke about using Clexane. Clexane is an injectable.
Injectable, right.
Who administers that Clexane to the patient while they're at home?
Very good question. If you have a doctor or the patient, it can be self-administered. It's in the same category as insulin. David? I think we lost David.
Okay, thanks. That answers my question.
Yeah, and so the dose is calculated again on the body weight, and yeah, we teach the patient or the relative how to administer it for the 7 days or 5 days, and then the follow-up, as I mentioned, we give them another 2 weeks of oral anticoagulants.
Zara, I'm seeing your hand up. You want to come back?
Yes, I do. I have another question related to hospitalized. Okay, people who become hospitalized. There was an article in the papers today with a woman who said that she had been hospitalized for surgery and developed COVID-19 there, right? And I remember writing to you just this morning about it, to ask you about it. And you had raised a point about COVID-19 being spread in hospitals, right? I want to get a sense of what is going to happen. What is the advice to the MOH if it really is happening that there are more persons developing COVID-19 while at hospital? I get the whole concept of treating COVID-19 early in the game from home so that people don't end up in hospital. But for those who present at hospital with a different ailment, what is the government or what is the medical profession recommending to reduce the spread of COVID-19 at hospitals?
Leroy, you want to take that one? It's point really directed at the government.
Well, I mean, there is some, hold on. There is some truth in the fact that people can acquire the infection while they're in hospital. There are truth to that. Every person going in for a surgical procedure, I mean, have to do a PCR test prior to surgery. So there's documented evidence that they do not have the infection going in, but I mean, it's an airborne virus. So the hospital is a high prone area to have the virus, but I'm sure that if proper sanitation and sterilization procedures are followed carefully, then that should significantly minimize the chance of getting a coronavirus infection in the hospital. We do not have anybody on the from the hospital on this panel, but I'm sure that there are proper protocols and procedures. Roger, you do surgery, so you should be able to tell.
Okay, everyone.
Go ahead.
I just want to remind you what's the basic theme behind this conference that we've called. And it's really to alert the consciousness of people that coronavirus is ideally treated at home. We have seen a number, several patients, some who have died, who went into hospital because COVID is concentrated there. They went into the hospital, contracted COVID, and came home with it and gave it to their family members. And patients died because at home, when they're now symptomatic, instead of running back to the hospital, they're waiting further to watch it because they were told to watch yourself. In fact, they left hospital not knowing that they picked up the infection, and shortly after they become symptomatic. And so several people have died. I know a 26-year-old alumni of a very prominent high school in Kingston who died, an engineer. She died having picked up coronavirus in the hospital. So it is a major concern. And that relates predominantly to concentrating coronavirus care in little epicenters. So the patient, 104-year-old lady that I related to you, she picked up coronavirus infection in a hospital for, after surgery, and went home with it and passed it to her daughter. So we know it's happening. We know, but it's perhaps reflects what's happening in society. But we think because of the concentration of sick cases inside the hospital, you're more likely to pick it up and pass it on in the hospital. Okay, I have a question. Is it Williams? Mr. Williams, you want to come back? Mr. Williams? Okay.
I think some persons just forget to take off their hand.
I think so. All right, very well. Yes.
Roger, can you please check in the chat group if there's any pressing questions or issues there?
Okay, I shall, Mr. Co-Chair. We get Stuart Spencer. Stuart, gonna unmute you. Welcome from the Kiwanis of Kingston. And
yes,
go ahead.
Thank you. Thank you, Dr. Hunter. I wanted to ask a question about antibodies, because I'm wondering, are antibodies specific to a particular illness or a particular disease? When you say, for example, if your antibody levels are high, I'm wondering because I've got an impression that let's suppose you got COVID in the early stages and you have developed antibodies. Would those and do you need a different? Is it the same set of antibodies that will fight a new variant? I just want some clarification on how antibodies function and whether they are specific.
Thank you for that question, Stuart. That's an excellent question. Yes, antibodies are pretty much specific. They're designed against that particular variant. And that's the problem with COVID, that you got antibodies for COVID, say the wild type, the original type. Those antibodies will be less effective than a couple variants down the road where the virus is changed to what's called immune escape. Dr. Vernon Jones will remind us about the immune intelligence, but there's immune escape by the virus as well, the law of nature. The virus will try to do everything to escape. So the antibodies that we are referring to would be related to the infection that we particularly got. So the levels also fall, but that doesn't mean that those antibodies will help us in December or January when we have maybe a couple more variations of the virus down the line. And that is also the same issue regarding vaccination. The vaccination is going to be tagged, it's going to give a response to that particular vaccine that you're given, which reflects a certain type of coronavirus. And we know all the vaccines were developed around the original wild type coronavirus. Now we're down to the Delta, and every study has shown that the vaccine efficacy has significantly fallen from all the vaccines, whether mRNA vaccine, Moderna and Pfizer, or we're talking about the AstraZeneca vaccine, the Johnson Johnson, their efficacy, they've fallen. So yes, antibodies are specific to that particular agent, and you may have some coverage for a variant or two down the line, but the efficacy is not as high as efficacy around that particular variant that you got infected with. So I hope that makes sense.
Thank you. Let me just ask a follow-up though. I think one of the things that has contributed to vaccine hesitancy, let's use that term, is information which, and I've not heard a response to this. And again, this could be information which is inaccurate, but information which suggested that your own antibodies, which you have for other illnesses that the body's immune system can fight off, are somehow made less effective by the vaccine. Is there, I don't know if you have heard that, or is there any truth in it, but I know that that has contributed to vaccine hesitancy. So it should be addressed if there's a reasonable response.
Okay, Mr. Chairman.
Do you understand what I'm saying, first of all?
That the vaccine,
or what I'm asking?
The vaccine immune response will dampen.
Yes, dampens the ability of the body's other antibodies then to fight the other diseases that they are supposed to fight.
I don't think that I don't think we can say safely that's the case, because that would be criticism for vaccines as a whole, that having a polio vaccine will hamper your ability to fight a pneumonia, bacterial
I think that's
pneumonia.
specifically in relation to the mRNA. I think that's specifically in relation to the mRNA.
Okay.
Technology.
I don't necessarily have that information.
Okay.
At hand.
Yeah, we don't have that information. We could get it from our vaccine specialists, and maybe at a later date we present that answer to you. But for now, we're not aware of any such issues there.
But the overwhelming message is to treat early, monitor with O2 sat at home, get in touch with your local private practitioners who are the champions for local first responders healthcare in your home and in your community. You need to connect, to log on to your local private practitioner. You need to log on to, well, whatever government service provides for in-home care. I don't know if the government does that, has that sort of facility. I know there's there are public health nurses that go around and check on the health of people in the community. But to what extent they can treat people in their home, I don't know if the government public health provides that sort of support. Carol Bridge, I'm gonna ask you to talk. Carol, want to unmute, Carol?
Yes, I wanted to ask, first of all, if you could, I know that the ivermectin is based, I know that the ivermectin, somebody else is speaking as well, I don't know.
You just mute.
I wanted to ask, first of all, I know that the ivermectin is based on your body weight, but I would love if somebody could detail out, apart from the body weight, what are the other protocols that you add for at-home treatment? Secondly, apart from having an oximeter and a thermometer, so you would have your ivermectin that is given to your body weight, but what are the other things as well that go along with it? And the other question was, if I suspected that I had coronavirus, say I wasn't feeling well and maybe I had a mild fever, and I then go and do a quick antigen test and it shows I have corona, should my next step be to go to my doctor, and would my doctor then have ivermectin to give me? That's what I'd like to know.
Leroy, you want to take that one? Or Jermaine?
It's still going on, so you can log on.
All right. I think I'm trying to remember Carol's entire question, but I think she said what else apart from the body weight. So the body weight and the severity will determine mainly the duration. So the severity of the illness, you calculate it on a 0.2, 0.3, 0.4 milligram per kilogram as a single dose for about, some people say alternative days for 5 days or every day for 5 days. Some studies goes up to 14 days, depending on the severity of the illness. The endpoint really is that once you are symptomatic still from the virus, you should continue the ivermectin. And apart, because it helps, the anti-inflammatory aspect is one of the biggest key factors to the ivermectin. The other thing is that it does decrease the viral load. And by decreasing the viral load, it gives your body the chance or the opportunity to recover. We just want a fighting chance. At the end of the day, we want a fighting chance. So with
yes,
that
I understand
hydration.
That. Right. I was saying, I understand
Sorry?
that. What I wanted to, I understand that. What I wanted to know was what are the other. Okay, all right, sorry.
Carrying from the start to the finish. So hydration is also important. Hydration to the point where you're getting up to go to the bathroom every half an hour to urinate. Rest is important. Just lie down, of course, not on your back. Some people might say, depending on your mobility, you sit up in the sun or outside on the veranda. But rest and hydration is very important. So that in terms of medication that supports the ivermectin, everybody talks about the vitamins C, D, and zinc. The other aspect has to do with to prevent the sequelae of the coronavirus, which is the pneumonia. So we give antibiotics to cover the bacteria that will jump on you because your immune system is low from the virus infection. So that is really the reason behind the azithromycin, the levofloxacin, the doxycycline. The idea is that these opportunistic infections, we want to prevent it from creating a pneumonia or a COVID pneumonia. So those are, I think, based on that, and the ivermectin is what we would definitely would use. Now, you also speak to availability. This is why we're here. We want the government to give LASCO and other distributors the license to take it in, because we know it's safe. You know, we know it's safe. We're not here to debate whether the vaccine work or not. The study shows the vaccine work, but we are a little way off in getting herd immunity via vaccination in Jamaica. So we want everybody to have a fighting chance. That is the bottom line, and for life to continue. So it's a matter of putting that point out, so everybody is aware that what we can do at this present time. So I hope I answer your point, Carol.
Yes, Dr. Spencer, I just wanted to say, so if today, what I'm really asking is, if today I had symptoms, could I go to my doctor and be given ivermectin? It would seem no. So that's...
No, there are you remember that there's multiple flights coming into Jamaica, and there are multiple sources that take in ivermectin on the airplane to Jamaica. And it's in the hands of some pharmacies and it's in the hands of some doctors' offices. And I'm saying it is available, but it may take a little bit of detective work to find out where it's available. But it is here. And I know for a fact that the government has given LASCO the permission to bring in ivermectin, and I'm sure it should be flooded in the pharmacies soon and very soon.
So it's a kind of hit. It's a kind of hit and miss business whether my doctor would have it or not. Is really what you're saying. Until the government allows it in. I just really feel I'm so glad for this forum because I really feel that it's not an either or against the vaccine. It is that we need early treatment at home therapies just as we would for anything else. And so I cannot for the life of me understand why they would rather we go to hospital when we're half dead rather than when we can do some treatment at home. And so I'm really glad for a forum like this. And I really pray that people will be listening and putting pressure on the government to bring this thing in, because so many doctors, I've had friends that have taken it and they've been better within 5 days. And so I mean, I'm a person who suffers from inflammatory autoimmune diseases and I'm on immune suppression medication. I cannot take the vaccine at the moment because it wouldn't work on me because I'm on immune suppression drugs. So I really want to know that this thing is available. And there are many people like me in Jamaica, many people.
Carol, do you have,
yes, sir.
Do you have an army of friends? Are you a connected person?
Well, I think I think we're all connected nowadays with this.
Exactly. Yeah. I want you to take home the key message. Early treatment works. We are embracing ivermectin. We are embracing other treatments, antibiotics, blood thinners, dexamethasone steroids, steaming, oral hygiene. It's an arsenal of treatment. And we are saying, get in touch with your local family practitioner. Don't just go for them, go to them if they're sick, if you're sick. Develop that relationship so that when, you know, if you have your pulse oximeter, get your pulse oximeter at home, get your O2 sat, get your temperature at home, right? Get these things in every home in Jamaica. Announce it throughout every corner of Jamaica so that people can be empowered. And you need the first port of call for 90% of Jamaicans when they're sick is going to be your independent public health practitioner, your general practitioner. And so it's important that you get that initial contact, get in touch with the Dr. Leroy Heyman, Dr. Michael James, Dr. Vernon Jones, Dr. Susan Minot Arscott, who are absolutely there with you shoulder to shoulder and are treating with you on a virtual platform. So you need to carry that message to your friends, to your church, to your communities, that early treatment works. It's not just about watch and wait.
Thank you so much, Doctor, the doctors, and especially Dr. Jermaine Spencer for answering me. I just want to say, did he say then, ivermectin according to your body weight, vitamin D, vitamin C, zinc, and maybe dexamethasone if there's a inflammatory problem. I'm just trying to make it clear for people because it's getting clear for me. And I think as a lay person, it might be helpful. I saw somebody else asking the question. And steaming, those are really the things, right?
Oral hygiene, brush your teeth, floss 3 times a day.
Right, so DC, zinc, ivermectin, Listerine, steaming. Okay, thank you so very much, Dr. Spencer and Dr. Hunter and all the other doctors on this Zoom. I really appreciate what you're doing.
My pleasure.
Thank you.
Pleasure.
Roger, if I may interject here a little bit.
Yes,
no,
Mr. Chairman.
I love the way she specified my doctor because right now is not all medical practitioners are doing treatment. Some prefer to do the test,
lovely,
make the diagnosis, and send to other doctors for treatment. So as a follow-up to this presentation today, we'll be organizing another forum to pass on our experiences to other physicians who are presently not treating. And so we will try to bring everybody on board. So that will help have more physicians treating. So that will definitely put a curtail on the hospitals being overwhelmed, less hospitalization. And secondly, we're going to have a private public partnership also, because I mean, it's not everybody can afford to go to a private physician for treatment. So we'll be having forums with those in the government sector to share our experiences. And so when they come to the clinics also, everybody would be on the same wavelength. Everybody will be offering the early treatment. Everybody will be monitored from home. And then, as I mentioned before, the outcome is going to be very good, less hospitalization and less death.
Mr. Chairman, I thank you and I thank everyone. Unfortunately, I've had a previous engagement and I'm absolutely required to go now. I thank everyone for listening. I thank everyone for coming. But a key message I hope to drive home again: early treatment, not watch and do nothing. Early treatment. Get your pulse oximeters, get your O2 sat, get your temperatures, and engage with your local private practitioners, or find one of us, any one of here who have treated corona successfully. And I think that would be good. I have to exit now, Mr. Chairman.
Yes.
I thank you very much.
Yeah, thank you all for attending, the media and other members of the public. We appreciate your presence on this platform today. Thank you all.
My pleasure to be here. Thank you.
Good afternoon and okay, thank you.